27 years old man. He has been complaining from loose motion for last 3 months. His complete blood count showed white blood cells 2,700. His hemoglobin 9.2 gram per deciliter and platelet 157,000. His erythrocyte sedimentation rate is 52. For your kind care and assistance.
معلش يا دكتور احمد بس لو تعيد الحلقه تاني بعد اذنك.
Male patient complaining from loose motion for last 3 months. His complete blood count showed showed that white blood cells 2,700 with normal platelet 157,000 and hemoglobin 9.2 gram per deciliter. His erythrocyte sedimentation rate is 52.
يا دكتور احمد
اتفضل يا فندم.
Good morning.
Good morning, doctor.
I am Dr. Zakaria, Senior Office Officer in the Medical Board for today. I am speaking to Mr. Ali, 27 years old. Is it I'm right?
Yes, doctor.
It's nice to meet you, Mr. Ali.
Nice to meet you too, doctor.
Mr. Ali, I just received your GB letter about speaking about you have a loose motion. Can you tell me more about your symptoms, please?
Yes, doctor. For last 3 months, I've been complaining from loose motion. It has started gradually, but and it is getting worse by the time. I received medication for it from GB, but this medication didn't help me at all.
Yes, Mr. Ali. Please tell me attacks or every day you have.
It's always there, doctor.
How many times per day?
It has started 3 times daily, but now up to 6 times.
I am sorry for that, Mr. Ali. Mr. Ali, there is any variation between the daytime and night time?
No, doctor.
Mr. Ali, can you prescribe what is the loose motion you mean by loose motion, please?
I mean that, doctor, there is the back passage is soft, and there's frequency of attacks.
Yes. There is any change in color of your back passage motion?
No.
It is accompanied by any blood or slim?
No.
Mr. Ali, there is any fever, increase in your body temperature?
I feel, doctor, there is low-grade fever.
When it started?
It started also 3 months back.
Do you measure it before?
No, doctor.
Yes. You mentioned you went to the GP and prescribed your medication. What is your medication he prescribed for you?
I can't remember that, doctor. But he told me this medication for 5 days, and my condition will be better after that. But it doesn't help me at all.
Mr. Ali, I will ask you some questions about your body weight. There is any change in your body weight recently?
Yes, doctor. There is decreased in the body weight.
How many kilograms?
I lost 6 kilograms in the last 3 months.
There is any change in your diet?
No change in the diet.
You have intention to increase your weight?
No, doctor.
Mr. Ali, there is any headache?
No.
Night sweating?
No.
Abdominal pain?
Yes, doctor. There is abdominal pain. There is tummy pain, yes.
Yes. It is all over the tummy or a certain area you're complaining of pain?
All over the tummy.
Yes. If we scale the pain from 1 to 10, 1 is the mild, 10 is more severe. What is your degree for grading for this pain?
3 over 10.
What is the type of this pain, Mr. Ahmed?
It is colic pain.
It comes in attacks or not?
Yes, doctor.
What is relieving this pain?
It relieves by evacuation of back passage.
Mr. Ali, now you have loose motion and low grade fever, low increase in your body temperature, and decrease in your body weight, about 6 kg, and there is abdominal pain related to evacuation. Mr. Ali, I would like to ask you some questions about your systems. Is there any mumps or lumps in your body?
No.
There is any skin rash?
No.
Yes. There is any muscle pain or joint pain?
Apart from generalized fatigue, no other pain.
Yes. Yes, Mr. Ali. Is there any change in your water work?
No.
It change in its colors or its amount?
No, doctor.
Please, again, for your back passage, is it evacuated easily from the toilet? Or?
Yes, doctor.
Yes, Mr. Ali. There is any night sweating?
No. No.
Any shaking of your hands?
No.
Any change in your bleeding of vision or any or change in your sight?
No.
Yes, Mr. Ali. There is any chest pain?
No.
Is there any heart racing?
No.
Yes. There is any swelling in your limbs?
No.
Yes, Mr. Ali. Mr. Ali, there is any change in your diet?
A change in what?
In your diet?
No, doctor. It's the same.
There is any certain diet which increase your loose motion more?
No, doctor.
Mr. Ali, what is your job?
I am a businessman.
What do you travel abroad?
Yes, doctor.
When you recently travel?
Yes, doctor. I just returned back from India 3 months ago.
Yes. Do you have any contact with patient with chest bug?
No.
Can I ask you some private question? Are you married?
No, doctor.
Do you have any extramarital relationship?
Yes, doctor.
Can you explain more about your partners?
What do you mean, doctor, by that?
I mean, do you have extramarital relationship when you travel abroad?
Yes, doctor.
Yes. Do you any contact any partner have certain viruses like HIV?
I'm not sure, doctor, about that.
do you have do you had protected sex?
Sometimes, doctor, and sometimes no.
When you last unprotected sex you have?
In the last visit.
Yes, Mr. Ali, with whom you are live?
I live alone.
Yes. Do you smoke?
Yes.
How many cigarettes per day?
1 bag per day.
For how many years?
For the last 9 years.
Do you drink alcohol?
Yes, doctor.
How many units per week?
About 15 units per week.
And at the weekend?
All, doctor, per week is 15 units.
Yes. Yes, Mr. Ali. Mr. Ali, I would like to ask you, there is any numbness or abnormal sensation in your hands or feet?
No, no, doctor.
There is any shortness of breath?
No.
There is any difficulty in swallowing or?
No.
There is any change of your whitish of your eyes?
No.
I asked you before about skin rash. Do you have any skin rash?
No, doctor.
Yes. What is the, do you have any drug regularly?
No.
Do you have any drug which increased loose motion before?
No.
Like Lex? Do you have any recreational drug?
No.
Yes, Mr. Ali. Mr. Ali, I get from your today you have loose motions with some increase in your body temperature and decrease in your body weight and abdominal tummy pain, which relieved by evacuation, and there was a history of ruffle uproots with an extramarital relationship, and you with unprotected sex. You drink alcohol, and you take smoking. You are a smoker. Mr. Ali, do you have anything more you can add for I didn't ask about?
No, doctor.
Mr. Ali, what is your concern?
My concern, doctor, I would like to know what is the cause of this loose motion. And also, I have one friend, he died from cancer colon. Is this could be related to cancer?
Mr. Ali, do you have any member of your family have a cancer colon?
No.
I asked you before, there is any change in the color of your back motion? Do you have certain anything to add about the color of your back motion?
Again, please.
There is any change in the color of your back motion? Any blood in your back motion?
No. No.
Mr. Ali, I appreciate your concern, and we will do some lab and some lab investigations and imaging, and we will put your concern in our mind. But from your history, it may we thinking about many things can cause this issue, in addition to cancer colon, which is your concern, and we will put it in our mind when we do this issue. Mr. Ali, do you mind, from your history, do you think there is any expectation about what is the cause of your
No,
condition?
doctor.
Yes. Any other concern, Mr. Ali?
No.
Yes. So, Mr. Ali, we will do our investigation and our investigation and imaging, and we will have a meeting with you to discuss your condition. Any other concern, Mr. Ali?
Okay, doctor. Thank you.
Thank you.
Yes, Dr. Zakaria. Could you tell us what's your differential diagnosis?
My differential diagnosis first, it may be due to infection because with especially with virus like HIV, as the patient has previous history of extramarital relationships and unprotected sex. Also, it may be inflammatory bowel disease, but against there is no other symptoms which can approve this autoimmune disease. It is inflammatory bowel disease. Also, it may caused by celiac disease, or malignancy will be in the differential diagnosis.
Okay. So what's your first differential diagnosis?
My first differential diagnosis, it will be maybe infection by HIV.
What is the type of infection here?
Type of infection?
Yes.
It may be sexually transmitted.
It is bacterial or virus or fungal infection?
It most probably to be bacterial saprophytic infection after HIV.
Yes. What is the name of bacteria that could be affected in the HIV?
I didn't.
What is the name of What is the name of bacteria could be the cause of diarrhea in HIV patient? In this case,
Sometimes TB can cause, but certain I don't know what is this special bacteria which can cause with HIV.
okay. What would you like to do for this patient?
For this patient, I will repeat the CBC and full blood count and inflammatory markers, and we'll do for this patient stool analysis and urine analysis, and we'll do also abdominal ultrasound and
Okay.
and
After it,
assay for HIV.
if this patient is HIV positive, what would you like to do for this patient?
If this patient is HIV positive, I will do for him antiretrovirus treatment and tracing of contacts of this patient.
Okay. What is the treatment of diarrhea in HIV?
It will support it, and the treatment of HIV. Treatment of HIV by antiretrovirus medications.
Okay, thank you.
Thank you.
طب. Any comment? Any comment?
Well done, Dr. Zakaria. But from the history, he can ask about diabetes, thyroid, Addison, systemic sclerosis, carcinoid. Also can ask about in history of operation for short bowel syndrome. And otherwise he did well.
This for the history, so that there's a lot of missing of the cause of chronic diarrhea in non-local cause, like Addison, thyrotoxicosis, or any past history of medical surgery that Dr. Gamal said. But what's about the differential diagnosis? And is there any significant for complete blood count? There is low leukocytic count.
The other side, leukopenia.
Yes.
It can be cancer.
It could be cancer, but there is no any blood in the stool. So that's what's the first differential diagnosis. This patient has risk of HIV. What is the name of bacteria could be the cause of diarrhea in HIV patient? Or what is the name of virus?
Mycobacterium or Mycobacterium.
Cytomegalovirus. بالنسبة للفيروس cytomegalovirus.
Okay. Cytomegalovirus. It causes bloody diarrhea or watery diarrhea? Commonly more, yes. Commonly more than 70% the patient come with bloody diarrhea. So the cytomegalovirus, it causes bloody. This patient, there is no blood. Dr. Gamal said cryptosporidiosis.
Diarrhea.
It is commonly cause watery diarrhea.
Mycobacterium avium complex.
Yes, it is the third one. It causes watery diarrhea.
Also,
There is three now. Yeah. Cryptosporidium and Mycobacterium avium intracellular. What is the third one?
Typhoid can be.
Giardia.
التيفود السالمونيلا will cause bloody. الجيارديا okay. What about HIV itself?
Yes, enteropathy.
Yes, HIV could be cause HIV enteropathy. For this patient, the first differential diagnosis with HIV related diarrhea. First one, HIV itself. Secondary will be cryptosporidiosis. Third one, Mycobacterium avium intracellular. For cryptosporidiosis, what is the treatment? What is the treatment of?
Heart therapy, right?
Support treatment.
Hmm.
في certain drug بس طبعا difficult to remember.
طيب يعني لما يقول لك what is the treatment, we have first to check if this patient is candidate for treatment for AIDS or not. Because for cryptosporidiosis, there is no treatment if the CD4 count is low. So that we have to start or restore the CD4 count to normal to avoid recurrent attack of infection by this organism. If first, we'll do for this patient complete blood count and the CD4 level. If the CD4 less than the target, we have to start for the patient antiretroviral drug medication. اسم الدواء ايه بتاع الكريبتوسبوريديوم؟
خلص السكند بقى قريب يجاوب عليه.
نيتازوكسانايد. نيتازوكسانايد. طيب. النيتازوكسانايد هل بنديه للمريض اللي هو السي دي كاونت بتاعه قليل ولا نستنى لما السي دي كاونت يبقى نورمال؟
انت قلت يا دكتور احمد نستنى.
طيب بالنسبه للريسبونس للبيشنت اللي سي دي كاونت 4 نو significant response. A lot of patients diarrhea will be recovered after return of the CD4 to normal level count. Plus symptomatic treatment اللي هو for diarrhea. المايوبكتيريوم avium intracellular, what is the treatment?
Anti-TB medications.
what's up?
Anti-TB medication. For how long? And what is the name of medication?
1 year.
What is the name of drugs?
Ciprofloxacin, streptomycin, ciprofloxacin, vitamin.
Should include macrolides in the treatment of Mycobacterium avium intracellular. you can put rifampicin, ethambutol. You can put, but you have to include الماكروليدز اللي الكلاريسومايسين or azithromycin. This case just came 2 weeks ago in one center in UK, HIV-related diarrhea. All the scenario and all the discussion, what is the cause of HIV, diarrhea in HIV patient. The cause of diarrhea in HIV patients may be chronic diarrhea, HIV itself, cytomegalovirus, and it will be caused blood diarrhea more than watery diarrhea. Salmonella, it will be caused bloody more than watery diarrhea. Cryptosporidiosis, it will be caused watery more than bloody. The Mycobacterium avium intracellular, it will cause bloody diarrhea. The Microsporidiosis, it will cause bloody diarrhea. Other infections like amoeba, DIARRHEA, Clostridium difficile could be caused. The treatment of HIV of the CD count is low, and the treatment of the infection according to the result of the culture and of stool culture or blood test. For cryptosporidiosis, it have also immunological marker. حد عنده أي سؤال تاني؟
دكتور أحمد، طب احنا نقول الديفرنشال دياجنوزس الأول HIV related diarrhea والسكند possibility إيه؟
السكند اللي عندها هو HIV related diarrhea بس مفيش كانسر.
يس. طيب.
أيوة ما هو
يعني
HIV infection.
differential diagnosis.
This unified diagnosis.
This is infective. Yes.
Infective diarrhea. I have one question, but I will not answer it now. يعني I will postpone this to another scenario. It is not related to the differential diagnosis. It's related to the analysis of the diarrhea, because all of us forget 2 symptoms in analysis of diarrhea. So that next case we'll discuss also a case of diarrhea, but I will wait for the next case. Maybe one will tell us what's about these 2 symptoms. All of us, يعني even me, يعني, we lost these 2 symptoms. We'll see it in the second case. اتفضل يا دكتور أشرف، كنت هتسأل differential diagnosis في حاجة.
أنا سألت خلاص.
كنت بتسألني. يعني هو differential diagnosis diarrhea with weight loss. خلاص. watery وكلام واضح. watery diarrhea with weight loss. It could be infection زي ما احنا قلنا ال HIV. It could be cytotoxicosis عشان عندها في weight loss موجود معاه بس excluded no other symptoms of cytotoxicosis.
تمام.
بس أنا مش شايف أي differential diagnosis تاني بالنسبة للحالة دي.
تمام.
دكتور أحمد، بالنسبة للكونسيرن بتاع الكانسر.
It is unlikely because you have risk factor now of HIV. You have risk factor of HIV. There is no in the blood, and you will see you first by doing some investigation for you, and if the cause of the infection or bugs is not the cause, we will look inside your colon by camera test. Next case, we'll do next case.